1, go.
I've sat my patient up. He's very mobile and very active for being in a hospital bed. I'm continuing to ensure his safety by making sure that he is stable just in case he has any orthostatic hypotension as he sits up. So I'm going to just place a steadying hand to prevent in case of dizziness. While he's sitting up, I'm going to go ahead and check circulation, starting with the capillary refill. And the capillary refill is good. Now I'm going to listen to his lung sounds, and I'm going to auscultate and palpate as I'm listening for his lung sounds in the thoracic area. Okay, sir, here we go. Are you ready?
All right, let me know.
One ear,
Okay, start.
2 ears.
Okay, now I'm doing scenario 2, which is
I'm going to be following the Z pattern as I'm going down his back. Starting.
Before I do that, I've already done white, so this is my
At the first intercostal,
So I'm going to go get everything that I
first,
need.
third, third, fifth, fifth, and seventh, a little wider than the fifth. Seventh, seventh. And while I'm doing this, while I've got the back of his Johnny open, sir, can you take a deep breath for me?
Just one.
And I'm checking and I'm palpating his lungs as he's doing this. Palpate. His lung fields look good. And his lung sounds from the back sound clear. Now I'm going to take a good listen to the front. We're almost there, sir. Again, we're starting at the first.
It's my patient. So I'm going to get everything I need.
First.
It's a clean.
Third. Third. Fifth. Fifth. Seventh. Seventh. His lung sounds are clear. They're the upper lobes, they sound like you're breathing through a large paper towel tube. In the lower lobes, it sounds like you're breathing through a straw. I hear no crackling. I hear no wheezes. I'm going to listen to his lateral lungs, the lateral sides. You would just lift your arm, sir. Thank you. 3, 5, 7. Sounds good. Let's listen over here.
Okay. This is my patient that checked the order.
5,
It's
7.
a chest wound.
Thank you, sir.
Every day.
His lung sounds were excellent.
Selling.
And while I was doing all of this, I was also assessing his skin. His skin temperature is warm,
What I usually
dry,
do, I my
and even throughout his body, region that I have inspected thus far.
Privacy to look at
Here we
that
go.
wound. Let me just look at it.
Go.
Okay.
I'm now going to perform a focused assessment of
Got
my
everything
patient.
that I need.
According to the doctor's orders, my patient is in need of
provide-
colostomy care.
Privacy.
So, hello sir, my name
For
is
my
Laura. I'm
patient.
going to be checking your colostomy bag. All right? Can you give me your name? Excellent. Can you give me your date of birth? Fantastic. I'm checking.
I've checked it
And I'm
again. I'm not
checking.
going to check it again.
I'm going to provide for his
checked.
privacy as much as possible. I've already pulled the curtain, but I'm not going to expose all of them because it's uncomfortable enough. Here we are, sir. Okay.
This bed is so low for
His
me.
stool
I'm just going to
is-
bring the bed
The
up.
stool in the pouch is
Okay, it's okay.
it's
I'm
warm
not bending.
and it's soft,
Okay. Then I'm
It
going to
doesn't
go
look-
in here.
untoward. I'm going to take a listen to his bowel sounds. Starting in his lower quadrant, I hear bowel sounds.
And I take the
Upper,
whole dressing
very
off.
good. Excellent. Lower. It's kind of like a horseshoe. So we're going around. His bowel sounds are positive in all 4 quadrants. I'm going to palpate and make sure that there's no distension.
Okay. All the sides.
As I'm doing this, I'm going to continually make sure that he is comfortable, that he's not in any pain. You doing all right? Any pain on a scale of 0 to 10? Very good. So this is not uncomfortable at all.
Okay.
Excellent.
That's not
His belly
drainage.
is soft. No distension
And
noted.
it says no drainage.
No
I look
pain
at
on
it, there's no
palpation.
drainage.
No discomfort while I was
And I do
palpating him,
my
and his skin is
assessment.
warm and dry
I'm
and
looking at
intact.
the peri skin,
Now I'm going to
checking for color,
apply gloves.
checking for
I've
hyperthermia,
already done wipes. I've washed my
for
hands,
tenderness.
protecting his privacy, and I'm going to continue to ensure his safety and mine by wearing the gloves
Okay,
and changing
And I
them as
check the-
necessary.
incision line.
Okay,
I'm looking for
here we go.
symmetry.
I'm going to go from the out to the
Actually,
in
when I take this off,
so that I'm not
I palm it very well.
hurting him or his skin as I'm
Okay,
doing
and I
this. I don't want to,
throw it away.
I'm also going to protect with a towel, just in case there's any oozing.
Okay, yeah. Now I'm gonna dress my
Drainage.
wound.
Over
I'm
here
going
on
to
this
dress
side.
the wound.
Okay. And I'm going to dispose of this in the appropriate container.
Right, do this, let me just measure this wound.
Where's the... Ah. Trash can. Changing my gloves. Now I'm going to clean the area. I have some gauze. I have unopened sterile saline. I'm going to open it, pour a little in the trash to make sure that it remains sterile. I'm lipping it, and I'm going to add a little to the gauze. Put the lid on,
Although
and I'll
it's,
date that and time it when it is
dress
opened.
it, I'm still gonna maintain
I'm
my
going to
sterilness.
maintain a clean technique. Throw it away. Get another one. All clean. And change my gloves again. Allow it to dry.
Alright? Now, I'm gonna
Clean more clean
I
gloves.
open it, put the bottle, the cover, this way, not that way, for infection control.
Now,
And I'm gonna leave, we call it lipping.
how are we doing?
And I make
How's
sure
your
I
pain?
palm
How's your comfort
my
level?
right, and I don't wanna get it
Okay.
wet. I lead from non-right, and I lead just to get it.
I'm going to measure the stoma. The stoma is this portion of the intestine that is coming out through his stomach wall. It has no nerves in it, so it's very important that I make sure that the pouch opening is large enough to accommodate it. Alright, I tried it at 1.5, it was too small. 1 3/4 looks real good.
Then I'll
I'm
put,
going to go ahead and check 2 inches, and that was too big, so we're going with 1 3/4 inches. While I prep the colostomy bag, I'm going to put the skin prep on.
Once they enter the room, I'm going to make sure that my patient has oxygen now and did it at 2 liters. I'm also going to check for my next order, and it states that my patient has an order for albuterol.
okay? Now
This
I'm
is
gonna
gonna
clean
help
my wound.
everything adhere the way it is supposed to.
No
I'm not going
drainage,
to touch
dry
the
wound, I
stoma
still
with
have
the
to
skin
clean.
prep.
When I clean it,
8 rights. My 8
I'll
rights
clean.
are going to
And while it
consist of
dries,
my patient's name,
outer,
I'm measuring.
and I put in my garbage.
the dose,
Measured,
time, the route. the
and now I'm going to
reason,
cut
Clean
it.
from,
Cut to size.
another outer,
and the
I want to make sure that I don't accidentally poke a hole in the
I
bag.
put in my garbage.
I am going to start with my first right. I am not going to med card.
And I clean now from
Once
top
I
to
log
bottom,
my
the
med
center.
card, I am going to remove the medication, okay? Prior to removing the medication, this is where I'm going to do
In
my
my
first check,
garbage.
okay? And I'm going to make sure that I remove the
Now I'm
right
going to
medication. for
cover
the
the wound.
Okay? So the order is for albuterol, and this is a box of albuterol medication that's going to be administered. Okay? Once I've removed the medication, I'm also gonna check the box for the expiration date to make sure that the medication has not expired.
There we go.
And I'm also gonna check for the date on the box. It should be for 30 days. okay? Then I'm going to remove the medication and I'm going to place it on the med card and I'm going to make sure
Prep pad that I put on his head
So
time
dry
to
wound.
dry
Once I block the
and become a little tacky, which will help this adhere to the skin.
I'm going to do my
I'm going to make
second
sure
check
that
and
it's
make
hanging
sure
off
I'm
to the
comparing
side a little bit.
the medication with the MAR.
Take this
So
off.
this medication is for Delgado Diane. I
And
have Delgado Diane in the box. Okay, I'm going to check dose of the medication and I'm going to check the way that's going to be administered and the time that is going to be administered. Okay, I'll check again for my patient's allergies and I'll check for the medication record number. Okay, once I have my medication at hand,
you want to make sure that you have a nice, good seal so that there aren't any wrinkles because that can really irritate the skin. Just going to push down a little bit. You okay? You feeling all right? You have a nice, clean colostomy pouch now with a charcoal filter to help with the smell.
When I cover,
I'm going to make sure that he's clean over here, and he is.
out.
Dirty linen will go in the dirty linen hamper for whatever the facility provides. And the trash will get wrapped up and put in my gloves.
Okay, now I'm going to introduce myself to the patient.
Never put the dirty linen on the floor.
Hi, my name is Celeste Valdez, and I'm a student nurse. And I'm
Okay.
here
He doesn't want to be touched with nasty gloves. I don't want to touch with nasty gloves. I'm going to go ahead and sanitize my hands
These are going to be my two identifiers.
and get you set up, sir.
I place my medication and my MAR in a clean
All right.
surface.
I'm going to continually maintain that he is in a comfortable position.
Now
I will
going to
lower the
open my
bed.
MAR. Okay, prior
I'm going to lower the bed as soon as I've listened to his bowel sounds one more time because it is important to do it before and after.
So I'm going to pull the curtain for my patient to have first privacy.
That was a nice trick.
So,
We just thought I was
may I
making
please
you.
have your
Lower
first and last
quadrant.
name? Okay.
Upper
And
quadrant,
then the patient tell me the
upper
first and last name,
quadrant,
and I'm also gonna
lower
ask
quadrant.
the patient
again
his
in the
date of birth.
horseshoe.
And the patient's gonna
Bowel
give his
sounds
date of birth,
are clear
or
and,
date of
well,
birth,
they're
and
not
we
clear. I
compare
hear
the
bowel
MR.
sounds, they are good.
Once the patient
Good
has done that,
bowel sounds.
now I'm going to compare the
Good,
MR.
normal bowel sounds.
And I will
I'm going to make
take
sure
my
that
glove
And I'm
the
going to
MR
document
matches
the
name
right
of the
way.
on
MR.
the medication
I'm going
record
to make sure that the date of birth
that
And I want to
matches
write the
the date
date.
of birth on that MAR.
it was
I'm also
done
gonna make sure that the medical
at the
record
correct
number
time,
matches the medical
in the
record
correct
number on
manner.
the MAR. And I'm also gonna make sure that the allergies
After I take
listed
care
on
of
the
this.
MAR are the allergies listed on the name
And
tag.
time.
take care of this and
Once I've
all
done
of my
this,
trash.
okay, I'll place it down. I'm going to explain to the patient that I'm going to be administering a schedule updraft, okay? And that's gonna help him with his respiratory distress.
And
At this time, I'm going to
here we
do some
go.
vitals on my patient.
Documenting.
Since I've touched the patient, I'm going to do hand hygiene again.
Now, when I changed his colostomy bag, what I should have done
Um,
before I placed it on him
Okay.
was initialed it and with my initials
And I put it.
and the date and the time that
And
I
I'm
did
done.
this.
I'm also gonna ask
His
the
order
patient how he's
states
feeling. And the patient states
That
at
his
the moment
colostomy
that
here
he
is every
feeling
shift,
short in
change
the breath.
pouch every
Oh,
5 days.
You're asking the wrong
He had his
person.
last
vitals
pouch
that
change
consists of taking blood
5
pressure,
days ago.
a pulse, the respirations,
Okay,
and
so
also a
I am
temperature, and I'm also
documenting.
gonna do an O2 size.
And I'm also
Part of the
documenting that
I'm
his
going to
bowel
assess
sounds
the
were good.
patient for pain. I'm going to ask
There
the
we
patient
are.
from the scale of 0 to 10, 0 being the least,
Then
10
I'm
being the
gonna-
most.
I'm going to come back in about 30 minutes to make sure that there is no change in his condition. I'm going to make sure that he is still comfortable, his side rails are up, and his bed is lowered to the ground to provide for his safety.
Prior to taking my blood
Is there anything I
pressure,
can do for
I
you?
am
You've got
going
your
to
call light
check
within reach.
for the brachial pulse.
Thank you. Have a nice day.
Once I found